Hello everyone, good morning. Our discussion for today is all about the importance of undergoing health appraisal procedure by yours truly, Teacher Sanli. So when we say importance of undergoing health, we are going to first define the meaning of puberty. So when we say puberty, it is the stage of development when a person becomes sexually mature, and it usually happens between the ages of 10 and 14 for girls and 12 to 16 for boys. So it causes physical changes and affects boys and girls differently. So when the puberty hits, there are different physical changes that will happen to a boy and a girl. So we will know what are the different changes later. The physical changes during puberty are changes are mostly affected by the food you eat, your health habits, and status and heredity. So boys and girls should try to come to terms with these changes in their body. They should also avoid teasing and comparing one another because all of us undergone or will undergo puberty. So when we say physical changes, there are different effects every time we eat so much oily foods and every time that we sleep very late. So the physical changes is actually an effect to our food that we eat, the health habits, and the heredity. Like for example, um we have different hereditary, like for example, if our family is prone to breast cancer, so we should be much more careful because it's in our hereditary, or it could be passable from one generation to another generation. So this one is an example of puberty. So there is the different changes, and the example of the physical changes for our girls. Number one, it increases the height and weight. So as you can see, they get bigger because of fat development, and they get also taller by an average of 3.5 inches. So it occurs 2 years earlier than boys. The girls actually experiences um, more growth than more earlier growth than the boys. So girls also get fat because of the food that we intake. Number two, development of the breast. Number three, define hips and waist. And number four, we have the menarche happens, or the start of menstruation. And number five, the occurrence of mood swings. These are the different examples of the physical changes or emotional changes that the girls experiences. And so much with that, we also have the growth of hair in the public area, in the underarms, and thickness of underarms and legs. So number seven, the increase of fat tissues. 8. Active sweat and oil glands and changes in body odor, development of acne, and the maturity of reproductive system. So the growth of hair in the public area like underarm, this one, it occurs during puberty, and the increase of fat tissue because by that age or by that stage we eat so much food, most especially that oily foods, and the active sweat and oil glands and changes in body odor. So that's why we need to be um, much more we need to learn on how to manage our personal hygiene, and we need to practice personal hygiene for us to have a good odor. And the development of acne, it's common that you will experience pimples, like for example, at the age of 12 you can have pimples, so that's only normal. Number 10 is the maturity of reproductive system because at the age of puberty or at the stage of puberty, you will have your first menstrual experiences. So that is the 10 example of the physical changes once a girl is in a puberty stage. So for the boys naman, we have the increased height by an average of 4.1 inches and weight because of fat development. Like for a girls, the boys also get taller and get fatter. And number two, body hairs grow in public area, underarms, face, and thicker legs. So the most common there is the hair in our underarms. So that is an example. As you can see, in your underarms, some may be experiencing to have a hair growth in their underarms or in their face, then stronger muscles like that. Some especially if nagbubuhat kayo. So some of you might have muscles already, then deepening of the voice because the vocal cords get thicker and longer. It's the presence of your Adam's apple. And number five, the increased number of red blood cells. Ayan. So these are some. And number six is the active sweat and oil glands and changes in body odor. So like for example, the girls and the boys should know how to have the proper hygiene to have a good odor. Then development of acne. So that is common also for the boys. Number eight is the development of small and temporary breast tissue for some. Some may have some may have a larger breast tissue, but some they don't have. So that's also a normal change. And number nine, changes in testosterone level can bring sudden emotional changes and sexual feelings. So these are the different example of our physical changes for the boys and for our girls. So the effect on teenagers, one, we need to have a longer sleep, the clumsiness brought by growth spurt, sensitivity over their weight in teenage girls, and the worry brought by not developing physically as much as peers. Like for example, for the girls, you might be curious why other girls are having a much more larger breast but you don't have, because one of which is it is because it is hereditary. So if it is in your bloodline not to have a larger breast, so it is you should be thankful with that, and you should confirm with that because that's hereditary. And you need to have you need to be more patient because on the stage of puberty you will be exercising some clumsiness and you will be sensitive. So number five, you will be awkward also in showing feelings to others because on the stage of puberty, you will have your crushes or you might have your boyfriends. So you might forget to say or to talk to your parents about the feelings that you are that the feelings that you are enduring towards your other classmates or friends. And number six is curiosity about sex and trying to figure out their values around sex. So, about that one, I don't like to encourage you to do that. So please avoid that. As young as you are, please avoid that, and please manage to think that you need to finish your school and you need to help yourself as well as your parents to be productive in the future. And this one is the emotional changes. One, more time with friends than family. So by that stage of puberty, you would like to stay outside than staying at your home. But some introverts usually stays at home. And number two, questions about sexuality. Number three, thoughts and feelings are expressed in different ways, such as writing in a diary. So you are now experiencing different ways on how to express yourself. Like for example, talking with your friends, chatting with your friends, writing in your diaries, and talking with your parents. So those are the different emotional changes. And lastly, we have the awareness of privacy, like lacking of bedrooms, because you are afraid that someone will get inside with your room, and you are also ashamed that they might see something like your public hairs in your underarm. So you have that privacy, or you are aware of that privacy. So health appraisal define that it provides important information on the pupil's current health status. It also gives teacher an idea if their pupil is fit enough to participate in school activities. And it also gives teacher the opportunity to modify these activities and make them appropriate for the pupils. With health appraisal, the school administration could provide the following. One, access to appropriate medical supervision. So in our school, we have nurse and we have doctor and we have also dentist. Number two, development of a positive health experience. So we have also guidance counselor. If you think you need to talk with a guidance counselor for your um for the words of wisdom or for any positive thoughts, you can message me in the I can direct you to any guidance counselor. And number three is the opportunity for counseling regarding health problems. So um that is the services or activities that a school may offer to our following pupils. Especially if you need so, you can message me right away and I can direct you or I can recommend you um to the specific personnel or community personnel wherein they are going to be the persons who will help you to understand your feelings. Like for example, the doctor, nurse, dentist, guidance counselor, so on and so forth. Okay, so health appraisal procedures. The following are health appraisal procedures. One, the breast examination. It should be done um it should be done monthly, specifically 1 week after the onset of menstruation, and it is recommended to check your breast for possible masses or lumps the moment you start menstruating. So, you can check your breast after your a week after your menstruation and to check if there are lumps or kung meron bang mga bukol na tumubo. So if there is or if may nafi-feel kayo, you can ask the nurse to also check or verify the lumps that you are considering. Number two, like that one. In the picture, that is the sample of how to do the breast examination. Number two is the dental examinations. So when we say dental examinations, it will be conducted by the dentist. So the dentist do dental examinations to check if you are fit to attend school. And if you have undergone dental examinations before the start of the school year, you will just ask your dentist to give a letter or certificate for confirmation. So, if example you're wearing braces today, so you can ask confirmation or certificate of confirmation from your own dentist to pass or to submit that to our school dentist. Ayan. So, the dental examination will be done yearly in our school, but unfortunately, we don't have it yet right now because we are under pandemic and constructing the school. So, ayan, the dental examination, it's the patient and the dentist. Number three is the scoliosis test. So, scoliosis commonly develops during the growth spurt and adolescence. Like you through scoliosis test, you will be able to know the condition of your spine. Early detection prevents it from getting worse. So it's the check of your spine, and to prevent scoliosis, you need to stand properly, sit properly so that you can avoid scoliosis. And to sit properly, the first tool that you are going to use is the ruler. So every time that you put a ruler back at the back, then you should maintain it and avoid it from falling so that you can avoid also scoliosis. Number four is the vision screening. So vision screening, being not able to see well, can affect your school performance and your safety. So if you are experiencing blurry eyes or you are farsighted, nearsighted, you should confirm any medical certifications from your doctor or from your optometry, the doctor of the eyes, so that we can also suggest to our doctors the vision screening, so that if ever you have that farsightedness, or if you are nearsightedness or farsightedness, we can recommend you um any medicine for you to intake, and to and the fruits that is good for your eyes, so that you will have a good eyesight. Ayan. So it will be checked by our optometrist or our doctors. Number 5 is the hearing test. So, hearing can also affect your performance in your day-to-day activities. It is part of your health appraisal, and after the checkup, your doctor will advise you and your parents if you need to consult an audiologist. So, audiologist is the specific doctor for our ears. So, we need to test also our hearing because it is important as we study. We need to hear properly the lesson or the discussion of a teacher. So if you're also experiencing some difficulties in your hearing, you need to ask your parent, and we will seek the guidance of our doctor. And if ever the doctor cannot find any problem, we need to go to our audiologist to confirm if there's no problem. However, if there is, we need to undergo medications. Ayan. So, number 6 is the height and weight measurement. If you are small or thin for your age, the nurse or doctor will check its cause. Then, early screening also prevents obesity and stunted growth. So, the height and weight measurement is done yearly for us to measure who are those pupils that are obese, normal, and underweight. So this one also is very nice because the height and weight will be our tool to determine our BMI. So when we say BMI, it is the body mass index, wherein it measures your body fat based on height and weight that applies to adult men and women. So the formula to get your BMI is BMI equals to your weight divided by your height meter squared. So your weight should be measured by kilogram, and your height should be in meter. So um weight, like for example 60 kilogram divide by 1.53 meter. So since it is meter squared, so 1.53 times 1.53, you will times 1.53 to itself, so that you can get the value of the value of your height in meters squared. Like for example, this one. So the categories are, if you are below 18.5, you are underweight. But if you are 18.5 to 24.9, you are normal in weight. And overweight if you are already 25 to 29.9. So please also take note of this, the underweight, normal, overweight, and tsaka yung obesity. So, BMI of 30 or greater, 30 or more, you are already considered as an obese person. So, there are 4 categories: the underweight, normal, overweight, at tsaka yung obese. Ayan. So, to determine the BMI, again, it is the weight divided by height in meter squared. Ayan. I hope you understand, and if there's more question, you can comment down or you can message me right after this video.